Thank you all so much for joining us for this third and final day of our online simulation training. So today, our first session, you'll see a familiar face. I'm very happy to introduce Dr. Jessica Marsack. Dr. Marsack's research has focused on the effect of stigma and discrimination on various health outcomes for sexual and gender minority persons. She's committed to promoting diversity, equity, and inclusion initiatives to benefit this population, and she's served on the Gay and Lesbian Medical Association's nursing section. Her interests also include end-of-life care, which she deals with in her clinical practice. She works clinically in adult internal medicine at Michigan Medicine, with special expertise in providing peritoneal dialysis. Dr. Marsack provides medical, surgical, clinical instruction to our undergraduate nursing students, both at the hospital and in the simulation lab. Her clinical instruction encompasses a perspective of holistic care for diverse patient populations. She finds it personally rewarding to share her knowledge and to teach the methods needed to translate nursing theory into excellent clinical practice. We would also really like to thank Dr. Marsack for her amazing work coordinating this conference. So with no further ado, I'll turn my floor over to my colleague, Jessica Marsack.
Thank you. And as everyone before me, I will go ahead and share my screen here. All right, and I am going to stop my video just for bandwidth as well. So one of the last questions that we had yesterday was about pre-briefing practices. So what do we do outside of that simulation immediately before and immediately after? How do we pre-brief? How do we debrief to make sure that our students get the best experience possible? So that's what we'll talk about today. So the first thing we'll talk about is pre-briefing. So what do we do before that simulation? We'll define that, same in the purpose, and then we'll go through the INACSL standards of best practice. So what is pre-briefing? It's a process that involves preparation, giving students what they need to be prepared, and briefing, sitting down, having a really short conversation about what to expect. And what this does is it really ensures that our simulation learners are prepared, that they know the educational content, that they know the ground rules, and that they all know this before the simulation starts. This is not the same as pre-learning. So you can assign pre-learning or assignments ahead of time to get them ready, and we'll talk about that as part of the standards. But pre-briefing is really more than that. And these slides will be available to you all, and you can access the full INACSL pre-briefing standard at that link. So why does it matter? We talked yesterday with Dr. Adams about establishing a safe environment, and pre-briefing is a big part of that. If we pre-brief properly, then we've got everyone in the same mindset. We're getting everyone in the same shared mindset so that we're ready to take on the educational content of the simulation. That's preparing them, right? We're getting everybody on the same page. Once we're all together and we're on the same page, then we're going to do the briefing. We're conveying the ground rules. We're conveying the expectations. If we do that, if we have students that are prepared, they understand the rules, they understand the expectations, then they feel safe in that environment. When students are anxious, we know that they cannot learn, right? When they're anxious, when they're scared, they're not taking information in. If we can prevent that, then we've got more prepared and engaged simulation learners. They'll do better in the simulation, and actually, they'll do better in the debriefing process as well. So there are 9 total criteria for pre-briefing from INACSL, and this is a lot of information, and we'll briefly move through some of these things. Sometimes there will be a lot of content on the slide. Again, these will be available to you. So we're going to start with 3 general pre-briefing criterion first. So the first general one is you should be knowledgeable about the scenario, and you should be competent about pre-briefing. These are pretty basic things, right? If I'm going to educate my students about the scenario, I need to understand the scenario. If I'm going to do pre-briefing, I need to understand how to do that. And the first way you can do that is through formal coursework or ongoing training and education, which you all are doing right now. So congratulations to you. You can also conduct a really planned pre-briefing session. tie them back to the objectives of the simulation. What is it that I want to accomplish today? That's what we're going to talk about. The second general criteria is that it should be developed according to the purpose and objectives of your simulation. So you can't have one standard pre-briefing for every different simulation that you do. It really needs to be based on the goals of this session. So for example, if I'm doing a simulation on obstetrics, on birthing, as opposed to a simulation on trauma nursing, those are very different simulations, very different objectives, and I need to prepare my students differently for those two things. In addition, those are going to be different pre-briefings for if it's a general simulation, very low stakes, maybe just practice, as opposed to a summative, a test, a very high stakes simulation experience, right? I need to do probably more thorough debriefing for something that's very thorough that a student's grade might be based on. So for general sim, any simulation, my pre-briefing should be structured. It should talk about the requirements that we've already gone over for preparation and briefing, and it should be tailored to my objectives, right? All the things we've already said. In addition, if this is a very high stakes simulation, if this is something for a grade, if this is at the end of the course, I should provide information to my students in advance. I should give them time to review that information. Maybe I give it to them a couple days ahead of time. I also want to develop my materials with a rubric in mind. So if I'm grading them on this simulation, then I want to prepare them based on my grading style, right? I also want to be consistent as possible. And I can do that with pre-planning, maybe with a written script, especially if you've planned a simulation that maybe other people are going to be conducting for you to keep things consistent. Everything that I talk about should include orientation to the environment, the experience, and the resources, and we'll talk more about what that looks like. The last general criterion here is that you have to really think about the experience and the knowledge level of your learner. So if I'm going to prepare my students for simulation, I have to think about who these students are. If these are students who are novices, right, it's their first simulation ever. They've never seen the simulation center. They've never seen a mannequin. They've never done this before. Of course, they're going to require more information. They need to be shown how the mannequin works, what it looks like, what it can do, what it can't do. Now, if I've got graduate students who have been in my school for 3, 4, 5, 6 years, these are students who have been through multiple simulations. I don't need to do a pre-briefing that's as thorough for them, right? They already know how these things sort of work. But for everyone, we need to make sure that we're addressing the knowledge, skills, attitudes, and behaviors that will be expected of them. And that's important for any learning level, but you'll have to tailor that. So maybe I expect some lessened skills from my novice nurses, right? I don't expect them to do everything perfectly. I don't expect them to work the mannequin perfectly, especially the first time. But I am going to expect my graduate nurses, my nurses who have been with me for 3, 4 years, to do more. I'm going to expect them to be more engaged with that mannequin, for example. So once I've got those general things out of the way, then I need to think about, okay, what actually is preparation and what actually is briefing? And there are separate criteria, 3 for each of these. The first thing we'll talk about is preparation. 3 more criteria for that. Stick with me. So criterion 4 is, again, based on your experience, your particular experience. We need to make sure that our pre-briefing talks about our scenario objectives. I need to make sure that my materials are meeting scenario objectives. And this sounds easy, but can be hard to do. There's a real balance that I'm trying to reach here. What I want to do is what Anaxo calls decreasing the cognitive load. So I want to give my students enough information that they're worried less about the scenario so that they can worry more about what to do while they're in the scenario, which is what I want them focused on. But I don't want to make those materials too simple. If I give them all of the information, they don't have anything left to figure out for themselves, right? So I need to give them enough to make them less nervous, but also leave them space to push themselves to really learn. If I'm making materials, the best thing to do is to use organizational or regulatory requirements to guide those materials. So for example, if I'm teaching a simulation on alcohol withdrawal, then I want to go back to my hospital's policy on how to take care of alcohol withdrawal patients. Or I want to go back to my school's policy on taking care of alcohol withdrawal patients. So I'm not drawing these materials from nowhere. I'm basing them on policies that I use in the field. And all of that, again, is to decrease learner anxiety and increase that psychological safety. If they're prepared for the content, they will be prepared for the simulation. Again, a lot of this sounds a little bit repetitive, right? We're getting maybe into a little more detail, but it's the same concept. So this next criterion is a little repetitive, but the idea is, again, your preparation materials need to be tied to your objectives. What does that mean? Well, we're going to use a variety of activities to ensure that our learners are achieving our simulation outcomes. Different preparation activities and resources can help our students understand concepts in different ways. So there are a ton of activities that we can do ahead of time or give our learners ahead of time. And these are some of those ideas. So some students learn in different ways. Sometimes I want to give them maybe a pre-test or a quiz beforehand. So maybe I want to say, you know what, I want you to study this alcohol withdrawal protocol. Here's a short quiz about it to make sure that you are prepared for this scenario. Maybe I want to time my simulation after a lecture that I know they're having on that topic. So, okay, I know that you just had this lecture on alcohol withdrawal protocols in September. Now we're going to do a simulation on this activity in October, right? You just had this a month ago. Let's practice it together now. Other things that you can do, some of you have asked about virtual activities. Virtual activities are a great thing to do for pre-briefing and preparation. You can have them think about concept mapping or care plans. Audio-visual materials are great, especially if you have students who already have a lot of pre-learnings or readings, to give them more of a video or content like that to watch, or a podcast to listen to might be a little more engaging for them. And our last preparation criteria, number 6, is to plan the delivery of those preparation materials. And that might be prior to or on the day of simulation. What that does is it allows learners to complete those activities in advance. It might help them reinforce previous learning. So say they had that lecture in September, I give them pre-learning in the beginning of October, and now we do our simulation in mid-October. I'm building on the learning that they've already done for themselves. I've got a greater chance of success. There are some ways that you can try to ensure that your students are actually engaging in your pre-learning. There are a couple ways you can do that, and this is kind of personal preference. So you can consider using completed pre-briefing materials as a ticket to enter the simulation. So I need you to bring me a screenshot of proof that you completed that quiz so that you can start the simulation, right? That's going to help ensure that your students actually did that pre-learning, because we know students are busy, and if they see something that they think they don't need to complete, some of them won't if there's no consequence for it. So sometimes you do need to consider establishing consequences for not completing the preparation. So for example, you know what, that proof of completion for that quiz was your ticket to enter. Because you didn't complete that material, you're not ready for this experience, and you're going to receive a 0. You're not going to receive any points for this experience. That's going to work for some groups. It's not going to work for others. That's going to be up to your experience and judgment. You can also think about other short activities on the day of simulation. And this is something I really like to do with my students. So maybe just a facilitated discussion, a couple of questions that you've thought about ahead of time. You know, what are you most nervous about? Have you ever dealt with an alcohol withdrawal patient before? Do you feel comfortable with the protocol? Have some question and answer sessions before you start. Anything like that, that might help your students kind of get into the feeling of the simulation ahead of time. Our last 3 things to talk about for pre-briefing are your briefing criteria then, and there are 3 of those as well. So Number 7 is before that simulation. Again, everything we've talked about so far should be happening before you start that simulation. What you need to do is convey any important information about the expectations, the agenda, and the logistics. So part of decreasing that cognitive load and making our students feel safe in that simulation is having them understand the things that maybe we don't understand they want to know about. So how long is this simulation going to be? Is it going to be recorded? Is it going to be that we're all in the simulation room at the same time? Having some kind of written or maybe recorded plan, again, that can be useful if you have multiple instructors or multiple simulationists doing this same process. Trying to keep it the same throughout 7 different instructors is hard. So if you have something written or recorded for pre-briefing, it is going to help standardize that for you. And again, Anaxel really recommends that if you're doing something high stakes, if your simulation is for a grade, if it's summative, if it's something that's really important, you want to be as standardized as possible. We all know students like to complain of when there are differences in grading, differences in how things have been presented. This is going to help prevent that for you. And again, the idea is to set expectations and tone for the scenario. So what does it actually mean? When I'm setting expectations, here's what my students want to know. They want to know, what is the scenario? What kind of patient am I walking into? Is it alcohol withdrawal? Is it birthing? Is it whatever? Let them know what the scenario is. What are the logistical factors? Again, how long is this scenario? Is there going to be a bathroom break? Where is this scenario? If I'm a first-time student and I've never been in the simulation lab, just getting to the right location can be stressful. What is the agenda? What is the overview? Giving them an idea of those things really helps reduce anxiety. We also want to be specific about who is doing what. So right up front, I might say, this is an alcohol withdrawal scenario. There are 6 of you in this group with me right now. Right now, I want 3 of you to volunteer to be the first group who will be active and in the room with the patient. The other 3 of you will observe that first performance. When they're done, we'll talk about it, and then we will switch roles. The other 3 will go and be active, and the 3 who were active before will now observe, so that students understand how things are going to work. We're also going to set expectations about debriefing, which we'll talk about at length. One of the things that we mentioned yesterday with facilitation with Dr. Batish and Dr. Lee is the fiction contract. So really what this means is we know that students have to suspend disbelief, right? They know it's not a real patient. They know it's a mannequin. But if they're going to get the most out of the experience, they have to set that idea aside. They have to be willing to engage with that mannequin as if it was a real person. So we might say directly to our learners, despite the attempts to create a realistic environment, not all aspects of a simulation can be totally realistic. But I want you to try and immerse yourself in this experience, right? I want to tell you what can be simulated and what cannot. So in this particular simulation, maybe I have a very high fidelity mannequin. So you know what? You are going to be able to hear his heart sounds. You are going to be able to hear his lung sounds. If you talk to him, I will talk back as the patient through the microphone in that patient. So maybe that's the expectation. Maybe it's much lower. So maybe you're just working with a task trainer. That was a question from yesterday, right? Maybe I just have a dummy arm. The scenario is just about putting an IV in. And I'm going to say, you know what? I know it's just an arm, but please pretend it is a real patient. If you talk to that arm as if there's a patient attached to it, I will speak as the patient. Set those expectations. Criterion 8 is about structure. How do I create structure? How do I set expectations for that structure? So these are things that your students will probably be very uncomfortable with if they're newer, and you'll have to spend a lot of time on. Now, this is a criterion where maybe you can spend a lot less time with your students or learners who have been through this before. So we need to orient learners to recording equipment. Are we going to record you in the simulation? Are you going to be observed by other people? If somebody else is watching you, who is that person? Is it other students? Is it hospital administration? Is it other instructors? If we surprise them with people watching them, they will be thrown off. Those are expectations that we should set. We're going to review evaluation methods with them. I'm going to use this checklist to judge how you've done, and I'm going to let you know you'll get the results of your evaluation within the next week. We're going to talk about technology. So again, if you have very new learners, here is a mannequin. Here's what a mannequin is. Here's what the mannequin can do and cannot do. If we're doing something virtual, here's some of the buttons you might need to press. Here's how you turn on closed captioning. Here's how you raise your hand or ask a question. We have to orient students to that. If we're using any kind of commercial learning product, so any kind of Zoom even, virtual reality products, any product that your learner might not be familiar with, we need to orient them on ahead of time. We don't want them figuring out how to use the product while they're supposed to be focusing on the content of the simulation. And to let them know that we're going to support them, we are going to give them technology assistance. Unless the point of your simulation is for them to figure out a technology, then we want to give them as much assistance as possible and let them know, hey, that isn't the point of this. It's okay if you have tech issues. We'll help you. We're going to talk about, again, objectives, scenario, setting, standardized patients. So if we have actors instead of a mannequin, what is that going to look like? And our last briefing criterion is really what we talked about a lot with Dr. Adams yesterday. So if I can do all of these things, right, and I know it's a long list, 8 different things, but if I can do those 8 things, then what I'm going to accomplish in my pre-briefing is to make my students feel safe. I'm going to decrease their anxiety, and that's going to help us work better together. If my students feel safe, if I've accomplished my goal here, that lets my students feel comfortable to express themselves, to say, you know what, I didn't know what I was doing. I have a question about this, and they can do that without being uncomfortable or fearing consequences. Obviously, that's going to be different for a high-stakes simulation or something that's for a grade, but this is really important for new nurses, new learners starting out. I need them to be comfortable so that they can really engage with the scenario. If I incorporate activities that help establish an environment of trust, that might help. So we talked yesterday about, maybe just talking a little bit about yourself ahead of time, introducing yourself, making yourself seem more like a person and less like a terrifying instructor. That's going to help your students feel more comfortable. We create that atmosphere of trust and comfort by being accessible and approachable. So the more I say to my students up front, I want you to ask questions. This is the place to mess up, and that's okay, but I want you to learn from it. There are no stupid questions. I want you to ask questions all the time. They will feel better about that scenario, and that's going to help them be a little bit less defensive because they're not scared about how they're going to be perceived, and support risk-taking. I would rather my students and my learners take risks in that simulation. Maybe they jump on the chest and they start doing compressions when my mannequin didn't need them. But I would rather them take a risk and do something wrong than do nothing, than be that wallflower who's standing around and feeling nervous and not really engaging with the scenario, right? I want them to do something even if it's wrong. It's better than doing nothing. So all that said, I think this was shown in maybe our very first scenario, but this is kind of the standard at a glance. So all of that to say, if I learn nothing else, here's the slide I can focus on. If I'm talking to my students, preparing them before the simulation, here's what I need to do. Number 1, I need to know what I'm doing, okay? I need to understand the scenario. I need to make sure that my pre-briefing is linked to my scenario, to my objectives. I need to think about how much my learners already know and how I can tailor this experience for them. I need to develop those materials to meet objectives. I need to think about a variety of activities in order to do that. Maybe it's videos, maybe it's activities together, could be anything. I need to think about timing. Do I want to deliver those materials a week ahead of time so they have time to review it? Do I want to talk on the day of? Do I want to do both? I need to let them know about expectations, logistics, roles, so that they're not nervous about those things, and teach them in a structured way so that they understand the environment, they understand what's going to go on behind the scenes. And if I can do those 8 things, I'm going to have a psychologically safe environment, and I'm going to have students who are more engaged. Are there any questions about pre-briefing before we move on? Okay. So now that we've prepared our students, we've done the simulation experience went great, we're all set with that. Now what? Simulation is done, we're all standing around looking at each other. What do we talk about? How do we talk about it? That process is called debriefing. So we'll talk about it. Again, these slides will be available to you. You can access the full Inaxel standard here. And we'll talk about some models and tools. So how do I actually bring this to reality? So the purpose of debriefing after the simulation is to move towards assimilation and accommodation. So I want my students to assimilate that knowledge, to bring that knowledge into their own mindset, and think about how they can actually bring that knowledge into future clinical situations. So I don't want the learning to stop in my simulation. I want them to think, okay, I just spent 30 minutes on a simulation learning how to take care of alcohol withdrawal patients, and I forgot to take vital signs the way I was supposed to. So when I'm in the hospital next time, I'm really going to remember to do that, right? And there are actually some theories that state debriefing or after the simulation might actually be the most important part that allows for the most learning, the most engagement. So when I do debriefing, when I talk to my students after the simulation, what I'm aiming for is for it to be reflective, that students are really thinking about their own experience, their peers' experience, and reflecting on what happened, maybe what didn't happen, that it is iterative, that it builds on other things that we've already worked on, and that they are teaching moments, that I want them to really think about how things went, what we can work on next time, how do we build on what we learned. What I don't want debriefing to be is punitive or punishment. That's not my goal here. As soon as I start doling out punishments, learners are going to stop participating. I don't want it to be derogatory. I'm not talking down to you only about the mistakes that you made. Nobody has fun in an experience like that. Nobody wants to be yelled at. Nobody wants to be talked down to. So it shouldn't be one-sided either. It should be a conversation. Conversation is the goal. And I see a question in the chat. It says, can we use video recording to present debriefing in cases where we have many groups of students? For pre-briefing ahead of time, absolutely. For debriefing, yes and no. And I'll touch on that in just a second here. So I will talk about the use of video. Good question. So there are only 5 debriefing criteria, so not quite as long here. So criteria 1, again, very similar to your pre-briefing. If you're going to do a debriefing, you have to be competent. You have to know what you're doing, right? Same as criteria 1 for pre-briefing. Again, this is best done in some kind of structured way. We're going to orient our students or our learners to the same thing. What is the location? What is the timing? What are the logistics? Getting some education about how to do that, which is what you guys are doing right now, right? This is basically a continuing education for you all, and you've chosen to go out of your way to try and learn this for your students, which is incredible. We're going to seek feedback from everybody. I don't want it to be me just yelling at people. I want us to have a conversation. I want us to talk. I have to try and actively maintain those skills. The more simulations I do, the easier that'll be. We'll talk about some tools for debriefing that'll help us be competent in that process. So I'm going to try to show a video here. We'll see how it goes. And please feel free to throw up in the chat or just sort of say out loud if this video is not coming through. This is a bad example. So I'm sure we've all been in awkward situations like this where we're supposed to be having a conversation and it feels very forced. It's not going well, right? So this is a bad debriefing.
So how'd that go? Thought it was challenging.
I thought the patient got what they needed.
All right. All right. So does someone want to just summarize the case?
Patient was short of breath when we walked in. We assessed the patient, got oxygen on, had the family member there to help us out, and the patient got better. The patient got what they needed.
All right. All right. Joe, what do you think watching?
I kind of felt like it was a tough case for them. And there was a lot going on, and a lot to manage. But it went okay.
All right.
So Andy, do you have any gloves on? Make sure next time you do a case like this, make sure you put gloves on.
Well, what's the matter?
Make sure you have gloves on. Your safety, just make sure they're on.
All right, whatever.
And you guys put on oxygen a little late. So it was good that you put it on, but what took so long?
I don't know. We weren't quite sure if we needed to put it on right away. I think at one point Lori was talking to the son, and he said he has some kind of history. I kind of overheard in the background, but yeah, so I didn't think we needed it right away.
Can't emphysema, so want to put that much oxygen on a patient like that? I know it's not safe to do that, so that's what I was taught. They usually live around there anyway, so
Really? Who taught you that?
one of my instructors.
Where you heard that from?
Yeah, so you can give oxygen to patients with COPD. It's I know in the book sometimes it's not right. The instructors don't always get it right, but we're here now, and so go ahead, give oxygen to anybody who you think is in distress. If you need me to send the articles.
My partner actually last week was on the bus, and he had the same patient COPD. He put oxygen on the patient, and that patient crashed.
Well, maybe he was just sicker than he told you, but I'll send you the literature, man. You can read about it.
Okay.
And the bag wasn't inflated on the oxygen on the non-rebreather, so he's not breathing well through that if you're not giving him oxygen.
6 liters. I thought the bag was inflated and that was enough.
Yeah, I thought the same thing.
No, it should be 12. Oh, yeah, it was 12. Yeah,
To 12.
I was always thought it was 6.
that's not right. 12, and you inflate the bag before you put it on your patient.
I thought it just played it on its own. So
I thought you did. I don't know.
10 to 15, man. Give some leeway.
Minimum of 12. Minimum of 12. No lower than that.
All right, well,
So I think we can pause that example there. We've already seen a couple of things that we really want to avoid, right? Anybody else feel very awkward watching that? I felt very awkward, right? I almost lost track of who the instructor was because they weren't really facilitating that debriefing at all. He was kind of just letting students fight it out. He wasn't correcting any misconceptions, right? They had questions about oxygen, what levels. He wasn't providing any information. There wasn't any structure. And you can tell the students are getting frustrated because it's not a very structured experience. This is a debriefing process that is not going well. So what can we do to be better so that we can avoid this kind of awkwardness? Well, we're going to conduct this debriefing in an environment that is conducive to learning and where we're really focused on a couple of factors. So just like our pre-briefing, we want to think about confidentiality, okay? I believe someone brought it before. The old adage used to be what happens in simulation stays in simulation. That may or may not be true if we're recording it. But what we can tell our students is, you know what happens here is for our learning, whether we're recording it or not. And this is not something that I'm going to go and tell the next group, oh, Joe did this thing and he did it really badly, right? Because I want my students to have open communication. I want them to feel trust with me. And if they can do that, again, if we have that safe environment, they can actually analyze their actions in a better way. So instead of being defensive and saying, well, I was taught it was 6 liters, they feel safe enough to say, you know what, I might be wrong. Maybe it is 12. Let's ask. That's going to let them do more feedback and more reflection. And that's really the big goal of that debriefing. So how do I do that? How do I establish trust? with my students. And this is a hard thing to do because I am an instructor, right? I'm not your friend. I'm not your pal. I'm your teacher, but I want you to have that rapport with me. So how do we do that? Again, we're orienting our patients to the process. Here's what it's going to look like. It's going to take 15 minutes. We're going to go to a separate room. We're going to have an open discussion. I'll ask you a couple of questions. We're going to talk about that confidentiality again. We can talk about a code of conduct. So, in this debriefing process, we will not tolerate any yelling. We will use I statements. I feel that I could have done better on this. I feel that maybe the correct action was to use 6 liters, right? We're not using accusatory language. Whatever it is that you want your students to do, just set that expectation ahead of time. We're going to maybe acknowledge and validate their emotional response. And this can be very important when you're doing a simulation on a scary topic. So we often use simulation for topics that are difficult, that you may not always see. So we use simulation for codes, which are very high stress, sexual assault cases, which are very high stress, very emotional, alcohol withdrawal, suicide, very heavy topics for our learners. And if our learners are still wrapped up in, you know what, that was scary, I wasn't ready for that topic, or they're still working through the emotion of watching their patient not make it through that code experience, they're not ready to debrief. We need to sort through those emotions before we talk about actions that they took, okay? If we do that, then we're going to give them a little bit of positive regard. We're saying, hey, your emotions are important, and those are totally valid. You know what? That was a scary experience. Let's talk about that before we talk about what you did right, or especially when we talk about what you did wrong. And think about how your learners are different. So your learners might react to a simulation in very different ways based on their past experience, their culture, their background, their personality. So if you have a student who maybe does have a lot of experience with alcohol withdrawal, maybe they came from a family where that was a problem, they're going to react to that simulation very differently than someone with no experience. And we have to take that into account. I want to make sure that my nonverbal demeanor, my body language is encouraging, that it's open, right? We know how to do body language appropriately, but it's easy to forget. We want to engage the ones that were active, the participants, and the ones who were observing in the debriefing. And we're going to have to manage unexpected responses. So maybe I have a student with a background I don't know about. Maybe I have a student or a learner whose background does include a lot of alcohol abuse, and that was my scenario, and they might lash out. They might really respond to that scenario in a way that I was not expecting, and it's on me to manage that. I need to ensure balanced participation. So during our last session yesterday about facilitation, we talked about wallflowers. We talked about the nursing students who want to do everything, and how do I, draw certain people out and let certain people take a seat. Maybe it might be better to do that debriefing somewhere else. So if I have a conference room, if I have a debriefing room, and some places have this and some places don't, this is not a requirement. But if it's appropriate, maybe leave that room. If it was a very stressful code situation and your simulated patient did not make it, if your simulated patient died, if I'm standing in that room trying to talk about the experience, my learners are looking at that patient thinking about how they died. It might be better to go to a separate classroom to talk about what happened. But no matter what, the best way to do this is immediately, always. This would be my always recommendation. What I don't want is for my students to be sitting with what happened and thinking about it and stewing on it and getting mad about it for the next week before we talk about it. I want to talk about it right now. Number 3, we're going to do that debriefing with a person who can devote enough concentrated attention during the simulation to actually debrief about it. So what does that mean? Well, that means if I'm the debriefer, if I'm the person who's supposed to be having this conversation after the scenario, I'm going to do that a lot better if I didn't have to do every single role in the scenario. So if I'm voicing the patient, if I'm answering questions, if I'm controlling vital signs, if I am the one calling out different actions, bringing in different players, I'm going to have a much harder time paying attention to what it is my students did or didn't do. Because I have so much to do in the background, I might miss something that my students have done that I need to talk about. So we know that that's not always possible. Sometimes it's just you and you're running that simulation as best you can, and that's okay, right? You can still do a debriefing if you have to do everything by yourself, but it's going to be a lot easier if you have somebody else to take those roles on for you. Even if I can just get a coworker to say, you know what, can you just voice the patient for me? I'll do everything else still. That's going to let me debrief better. We're again outlining, we're setting expectations. So when I sit down, I want to say to my learners, I want you to drive this discussion. I might pose some questions, but I don't want to be making the discussion happen. What I want you guys to do is think about your own performance and respectfully provide feedback on other people's performance too. And that's an okay thing to do. We want our students to learn from each other. So to the question in the chat, different feedback techniques. So face-to-face would be by far the most common. You can think about numeric feedback. So if it's a code scenario, you know what, it took you guys 6 minutes, actually. I timed it to start CPR. It really should have happened in under a minute. What do you think could have been better? Maybe you've got equipment feedback. So if you have a CPR dummy, for example, that dummy might be able to tell you that those compressions were not deep enough. We know that some mannequins are able to do that, and I can provide that feedback for my students. Now, video feedback can come in two forms. So if you did record the scenario, you can show them the video replay. Show them their posture during that CPR. You know what? You got on the chest and you did a great job, but if you do CPR like that, you're going to hurt your back because you're not using your body weight. Look at how you were doing it. Let's try it a different way. So the question in the chat was more about, can I use video recording to present debriefing in cases where we have many groups of students? And the answer is yes and no. If you use a video recording for debriefing, what you can do is hit the highlights of things that are important to every student in the case. So if I have my alcohol withdrawal case, I can use a pre-recorded video to say, you know what, I want every student to know these hospital criteria. I want every student to review how often we have to take vital signs. So you can use video recording in that way. However, if you have only video recording that's pre-done, that's going to be better for your pre-briefing. That's going to be much better for ahead of time where you want every student to come into the scenario the same way. For debriefing, every scenario, every group that you do it with is going to be a little bit different. And so your debriefing should be much more individualized based on what you saw in that performance. So for that reason, to only use pre-recorded video for debriefing is going to do your students a disservice because it's not going to touch on what they did in particular. What it would be good for is to hit those things that you want standardized. I want every group to talk about this in debriefing. I want every group to review this in debriefing. But there really should be that individualized, you know what, I noticed that Jenny did this action. I noticed that Patchery took this action, which was really good and really fast, and we can learn from that, right? So in Axel would not necessarily recommend just video recording, unfortunately, even though that would be nice. Because what we want to do is provide concrete examples. So I don't want to sit in the debriefing and say, oh, yeah, you guys did a good job. Any questions? Nobody's really learning from that. I want to say, you know what, Patchery, you put that oxygen on within 20 seconds, and that was great. But you know what, Jenny, it took you 3 minutes to recognize that the oxygen level was dropping. So how can we maybe do that a little bit faster next time? Again, I want formative feedback. This is not punishment. It's not judgment. It's just saying, I saw this. How can we learn? So maybe thinking about this question, I noticed you didn't I noticed you didn't see the oxygen levels dropping for a couple of minutes. Help me understand why. Let your student explain, you know what, I was so wrapped up in the heart rate because I thought this was a cardiac scenario that I forgot to look, right? And if you can do that, if you can deviate from the script based on what you see in this experience, you can help facilitate critical thinking, judgment, reflection. That's the goal here. And ultimately, taking that into clinical practice. That's the whole point of simulation, right? Is to say, here's what we did here. How can I apply this in the hospital? How can I apply this in the field? How can I apply this in the clinic? And at the end, we want to summarize what we learned. We want to close those gaps in reasoning. You know what? Here's what we did great. Here's what we could have improved on and how we can improve on it. Thank you for participating. Now, if this sounds like a lot of work to do well, that's because it is. But we don't have to do it ourselves. We don't have to do it from scratch. There are frameworks that we can use that can help us structure debriefing in a very purposeful way. So there are a number of theoretical frameworks, and I'll share some of those with you. And they'll think about these things, right? So there's not one framework that's better than any other. What you need to do is look at these different frameworks and think about what it is you need to do. How complex is my scenario? What are my objectives? What's my level of competence myself? What is the experience itself? And when I think about my own simulation experience, and I look at these different frameworks, I can look at their criterion and choose which one might be best for me. And again, these are slides that are going to be available to you. This is the website where you can find a list and links to each of these things. We talked about pearls before, I believe, in a previous session. And we're not going to go through all of these one by one, but the idea is these things exist. There are already resources and frameworks and references out there for you so that you feel supported when you're trying to plan this out for your students, okay? So I will give you just a brief example of one of these. So these are 7 different examples. And then an 8th framework is called DASH, Debriefing Assessment for Simulation in Healthcare. So the idea of these frameworks is to really bring this from kind of theoretical language, right? Encourage learners, analyze and evaluate to, okay, how do I actually do that? To example scripts. So if I want to do this, here's what I say. So to pull out an example, just looking at discover. So what I want to do is analyze and evaluate performance. How do I do that? Well, I need to observe the event, right? I need to actually watch what my learners are doing. And then I can say something like this. I noticed you did put on the oxygen in the code situation. I was concerned about why you chose to do that action because I saw that you didn't start compressions. Can we talk about that? What could you do differently, right? So what these frameworks are going to do is help you go from this difficult, sometimes theoretical language, I don't really know what that means for me or what I need to do, into something very concrete. You know, here's your language example. Here's how you can address that with your students. There are also different ways to measure debriefing. So if I want to know if I did a good job, I can give my students a quick survey. This is an evaluation scale. This is an evaluation scale. I can give those directly to my students and say, you know what, I want you to anonymously, we want that to be anonymous or else they won't be honest. We know that. But I want you to anonymously grade how I did. Did you think this debriefing worked for you? And that's going to give you some concrete feedback, especially if you're just starting out, if you're doing these for the first time, it helps to have some feedback and sometimes a little bit of validation from your students that you are giving them what they need. And again, this isn't that one is better than the other. Some of them have different lengths, some of them are long, some of them are short. So just based on what you want it to do. The last criterion for debriefing is, again, hearing some repetitive language, that your debriefing is congruent with your objectives. You're not going to do the same debriefing for every simulation that you ever do. I want to structure it. I want to talk about things that are specific to this scenario. So if I'm doing a debriefing about an alcohol withdrawal scenario, then there's no point in me talking about chest compressions because that's not what we were trying to learn about today, right? So we're thinking about our objectives. What was my outcome? What did I want my students to achieve? Adjust my debriefing to that, adjust what I'm talking about. And then again, without being punishing, I do want to talk about performance gaps, but I'm going to think about those gaps in terms of what I wanted them to learn. So maybe they made a mistake where they didn't wash their hands on the way into the room. But that isn't the focus of this simulation. Will I mention it? Sure. Am I going to spend 10 minutes on it? No, because that's not the point. So now that we've learned all of that, let's see a much better example of debriefing. So this is somebody who's following those Anaxel standards, who has a structure, who knows what they're doing, and you're going to see those students react much differently than the first example.
So I want us all to be respectful of each other. Let's not overtalk each other. So if you have to rebut or you want to add something to the conversation, just wait for the person who's talking to be done so we can be respectful of that person. Can we all agree to that?
Yeah.
Yes.
All right, great. So I want to talk about just the learning objectives real quick and what I was hoping to get out of this. So the idea was for you guys to go in, put on appropriate PPE, identify a patient who is hypoxic and in respiratory distress, and administer oxygen in a timely fashion. All right, so benchmarks for performance for this patient is to administer oxygen to the patient quickly and efficiently using a non-rebreather mask, and to wear gloves while taking care of the patient. We use the American Heart Association's model of airway, breathing, circulation, and assessing and intervening for taking care of patients. So to quickly review what I was hoping to happen is you'd walk into the room, put on some gloves, introduce yourself, identify your patient, identify that the patient was in respiratory distress, identify that the patient was hypoxic while obtaining vital signs, place the patient on a non-rebreather, and have an ongoing level of communication with not only the patient, but with the family member as well. So to identify what happened, can you guys just walk me through your case?
Sure. There was a patient that we walked into that was short of breath and had some distress. A family member was there, gave us some information, we assessed the patient and put oxygen on. Patient got what they needed.
Sure. Do you agree?
Yeah, I agree. That's what happened.
All right, so now we're going to kind of examine what we saw and what occurred in your case compared to what we had outlined previously. And John's going to cover the PPE piece, and I'm going to cover some of the things we noticed about oxygen delivery. So, John.
So one thing I noticed in the simulation was he didn't have any gloves on. I just wondered if you could tell me a little bit about that.
Yeah, I didn't think I needed any gloves. I thought the patient was fine. I didn't have any contact precautions or anything, so I didn't have really any concern about it.
I could have looked out for him. I did put gloves on because I didn't know if the patient was going to be coughing stuff up and I could be exposed to it. So, I should have looked out for him and told him safety first, we come first.
That's good.
So talking about the oxygen piece, so we wanted you to deliver oxygen by a non-rebreather. And so I noticed it took you some time to get the non-rebreather on the patient. There was some discussion about his pulse ox level and whether or not it was high enough. And I was just wondering if we could just talk about that a little bit.
Yeah, I mean, I noticed when I put the pulse ox on, he was setting at about 88.
Mhm.
I had a concern that maybe that was a little too low for him. And I went to the doctor on when I talked with Lori and cross-check, she didn't think we had a concern yet. So we just held off for a little while.
Okay.
Yeah, and I know the patient had a history of emphysema, so I know you can't give him too much oxygen, so that's why I held off.
Okay. So certainly we want to be careful with giving too much oxygen to patients who don't need the oxygen, but patients who are in distress, including those that have COPD, we shouldn't withhold oxygen, and ultimately we want to deliver the right amount. So whether you start with a nasal cannula or non-rebreather, you ultimately want to marry to where the patient needs their pulse oximeter to be and to help alleviate their distress. The latest evidence shows that oxygen doesn't depress respiratory drive in patients with COPD. So although the theory and the chemistry might make sense on paper, clinically it really hasn't panned out that way. So I just want to kind of finalize and formalize the learning that happened today. If we could just go around the room, and if you want to share something that either went well or not so well that you're going to take back and trying to change in your clinical practice, and what you would do different next time.
Yeah, I guess I would have put my gloves on. That definitely is something I'll take home with me, just to protect myself better.
I think it's important to keep current on the the most recent literature regarding the use of the oxygen and whether or not you should or shouldn't give it to that patient.
I think we really communicated well with the family member, so I think that's a thing we did well.
All right, great. Any other questions that you guys might have?
No.
All right, you guys ready for the next case?
Yeah.
Yes.
All right,
Let's do it.
let's go.
Okay. So a much better experience, right? Felt less awkward. Your learners felt less defensive. There was more back and forth. You as the facilitator should actually jump in and correct things, let them know what to do better in the future. Otherwise, they're still going to walk out with questions. They're not going to maybe get the learning objectives that you wanted. So again, kind of at a glance, I want to make sure that I do that debriefing appropriately, maybe where it should be, maybe in a different space, being respectful. And I need to be competent in knowing how to do that, which you all are doing here today. When I'm debriefing, I need to promote self-reflection, team reflection, system reflection, oxygen issues, for example. And I can use theoretical frameworks to help me do that. I don't need to feel like I'm doing it all on my own. So, big overview, big recap. Pre-briefing is about setting clear expectations, and debriefing is really about following up on those expectations. So what do they have in common? You have to orient your participants to the material, to the setup, to the logistics. They should know what to expect. That way they can focus on the simulation itself. I want to keep my conversation and my materials respectful and tied back to my objectives. We heard that over and over, right? Everything I do should be specific to this simulation. And being thoughtful and using the framework or the Enaxel standards is going to increase the effectiveness of my work. You all work too hard to not meet the objectives that you want to. So use the frameworks, use the standards that are out there to help you be successful. And with that, I will take any questions you might have. I know it's a lot of content for this early in the morning. I see one in the chat. Because you mentioned about the observers, my students who passed the scenario, the first group, asked to be in the control room with the instructor to observe their friends, the second group. Is that okay to do? Yeah, absolutely. If you have space in there and if your students are not going to be kind of in your way as you're trying to facilitate these scenarios, I think that's totally fine. If you want them in that control room, they might be more engaged if they're really actively watching. I think that's not a bad thing to do at all. Any other questions? I think we have just about a minute here.
How do you handle the logistics if you're running multiple groups? You know, say it's a situation where you have access to the lab for a day. Say you have, 60 students, 10 groups of 6 running through pretty quick, all in a row. Do you try to, even if the debrief has to be shorter, do you recommend an immediate debrief versus, the next day during class time?
Yes, always. So Enaxel always recommends immediate debriefing just for these specific things maybe that you saw within your group. So if I only have a little bit of time to do my debriefing, then I'll talk more about specifics. You know what? I saw that you did this. That was great. I saw that you didn't do this. Can we talk more about that? Then maybe in your class the next day, I can talk about the big overall things that I want all of my students to hear, but do as much in the immediate as you can. And, I know we're spoiled at U of M and we have time. Sometimes we don't have time, even though we are spoiled. But even if you can just carve out 5 or 10 minutes, you can do a lot with that time. We have 1 minute left. Otherwise, we're basically on time. Is there any last question?
I guess you were super clear.